Just ahead on American Black Journal, Reverend Horace Sheffield III talks about his personal battle with COVID-19. And he's got a message for everyone about the seriousness of the virus. Plus, a look at the pandemic's impact on the economy and a little bit of music to soothe the soul. Stay right there. American Black Journal starts now.
Masco Corporation is proud to manufacture innovative and environmentally friendly products for the home. Delta faucets, craft-made in Merillat cabinets, and Behr brand paints have all been designed with you in mind. Masco and its family of companies, serving Michigan communities since 1929.
Support also provided by the W.K. Kellogg Foundation, a partner with communities where children come first. The Cynthia and Etzel Ford Fund for Journalism at Detroit Public TV.
The DTE Foundation proudly supports 50 years of American Black Journal in covering African American history, culture, and politics. The DTE Foundation and American Black Journal, partners in presenting African American perspectives about our communities and in our world.
Also brought to you by Nissan Foundation and viewers like you. Thank you.
Welcome to American Black Journal. I'm Stephen Henderson. At this point in the COVID-19 pandemic, chances are you already know someone who has contracted the coronavirus. Today, we're going to hear from a local pastor who is recuperating from the illness. Plus, there's a lot of debate on when to begin reopening the economy, both here in Michigan and across the country. Coming up, Michigan State University economics professor Charles Ballard will explain what's at stake now and in the future for the nation's economy. But first, Reverend Horace Sheffield III is a prominent pastor and community leader here in Detroit. He is the son of a great labor leader and the father of one of our members of City Council. He spoke with me earlier this week about his battle with COVID-19, and he gave his thoughts on the serious threat that is posed by the virus. It is really great to see you. It's always great to see you, but especially right now, I feel almost overjoyed to be able to have this conversation with you. Thanks for being here.
Well, you know, they say it's better to be seen than to be viewed. And so I'm as happy as you are.
Yeah, no, that was quite scary. Reading social media accounts that you were sick, I was really, really worried. Walk us through what you experienced.
Well, I'm the kind of person who likes to, keep my word. And I had been working on this Greenwood Chamber of Commerce project from Tulsa. I think you're pretty much aware of what happened there, the massacre there. And I'm the honorary chairperson for their historic site and redeveloping it. We got a $500,000 grant from the Parks Department. But I set up some meetings with Reverend Sharpton and some of Bloomberg's people, and the people were very adamant about not changing the date because it took so long to get this on the calendar. And I was like, hey, New York is the petri dish of this. We'll be fine. So flew in, went to the meeting, Stephen. On my way walking back to the hotel, something just overtook my body, And I thought for a moment maybe it was a sinus cold coming on or a fever. My wife's a nurse practitioner. She told me to get some Allegra D, which I did. Laid in the bed that night, I perspired. I had just extreme chills. At any rate, came home and that Monday, I came home on that Friday. That Monday, I went to be tested. By the grace of God, my wife works in the hospital system. She's a nurse practitioner. I didn't have a fever. So the protocol that's normally required to be tested, I would not have passed. And I was able to be tested anyway. And I, basically got the results. But in the meantime, I began to self-quarantine myself. My wife went and took a test the next day, and our results came back within a day of each other. It took 10 days for it to happen.
Yeah.
But in the interim, I did come into the office a couple of times. My chief of staff is the only person here in the office, because we had closed things down, that got sick because I was, talking with her at my desk, trying to figure out how we're going to pay people and keep things open and, reduce the amount of harm that people would have to experience in this crisis.
Yeah. This is a scary disease. It's a scary time. Talk about the fear you might have had when you get that positive test back.
Well, to be perfectly honest with you, as you know, the older you get, the more you're aware of your mortality. When you're young, you don't think you're ever going to die. So, I mean, it's not like I haven't had a couple of health challenges, but to be perfectly honest with you, I had to keep fighting back this fear that at any day, this thing could take me out. And my family thought I was acting strange because I got in touch with my son and my daughter. I have multiple insurance policies. My son on one, my daughter on another, my wife, whatever, letting everybody know where everything was in the house and who was on what. And they're like, "Oh, you're going to be," I said, "Well, look, I don't know." I talked to Isaac Robinson 2 days before he died. Now, one of the most damnable thing about this is this whole protocol of who could be tested.
Yeah.
Isaac didn't have a fever.
Right.
I didn't have a fever, and he, basically stayed home. I mean, we were told early on this myth that African Americans were not succumbing or even contracting this. I mean, there's so much stuff that makes me feel as if some of us are responsible and literally have blood on our hands for people who did not have to die, including this president, quite frankly, who knew about this long ago and said this is going to be down to zero. I mean, I now have talked with enough people, Stephen, to believe that maybe even November, December of last year, people had this. They just didn't know what it was.
You, of course, are a pastor here in the city of Detroit, and we're hit harder here than people are in other cities, and African Americans here are hit harder than other people in the state. I wonder what the last few weeks have been like for you in ministry.
Yeah, well, I've taken some hits because I've been a person. I just wrote an op-ed last night on all this nonsense. People going to church, having services, more concerned about perpetuating, payments to mortgage companies and all that nonsense. The Bible says, "Don't tempt the Lord." This is tempting the Lord. This would have been Jesus jumping off the cliff when the devil told him to, and told him that God, the angel will bear thee up. I mean, look, this is, I have had 41-year-old man in my church die. I'm doing 2 funerals back to back tomorrow and one on Friday of people in my church who have died. You don't think I wonder whether or not me having services up until 2 weeks ago maybe could have exposed my members? I mean, it's a possibility. I've asked God to forgive me because I didn't get my test results. I mean, I wasn't sure. So that's nonsense. I mean, people, we can get back to church, we can get on Zoom and Zoom him, but to be in close proximity doesn't make sense. And maybe this is a time for churches to look at their budgets and figure out whether or not, what they spend money on. I'm blessed we're mortgage free. So I don't have to worry about that. But both with my church and with DABO, I've managed to be able to keep 95% of my people on staff and on payroll and have them work from home. So that's not the issue. The most important issue is, are we saving lives? Are we protecting our people? And that's what a good shepherd has been called to do. On the other end, Stephen, I have found more people who have been loosely connected with the church, had a modicum of sense of need for God, who now have become prophets, pundits,
believers now, right?
All kinds of prophecy. I mean, I have people who are on my broadcast and on my on my Mevo broadcast who I haven't seen and giving money. I had a person give $400 a day, hadn't given $400 in 10 years. Okay, so I told a few of my friends, I mean, you almost wonder whether or not this might be the better route to go. Plus, this is the last point. Because we have people that love Jesus and can't stand anybody else, I have no conflict now at the church at all because they're not around each other.
I wonder if you can talk a little about what we're seeing in our city right now. Your family has a very long history in this city of serving it, when things are good and when things are bad. Talk about this moment in Detroit.
Yeah. Well, first of all, let me just say that we've worked some things out through some help with Detroit Edison, where tomorrow, which will be before the broadcast on Thursday, and for the next 2 weeks, almost 10,000 frozen meals will be distributed from my corner. I mean, chicken, greens, mac and cheese, all in frozen sealed packages. People can take them home and put them in their refrigerator. I think one of the things that we've seen, Stephen, is the degree to which people have arisen and said, we need to do things to mitigate the harm that this has had upon people. I will tell you this, I've had my issues with the mayor. There's no question about that, but I do think in real time, they've listened to my voice. I've been in touch with Alexis Wiley. The testing protocol where people don't have cars, don't have primary care physicians. That's not just poor people. I know folks with insurance, who have PhDs that don't have a primary care physician. The emergency room is normally ours. Mike should have known that. So in real time, a lot of that's been adjusted. I've also come to find out from the governor and other people, a lot of that is because they didn't have the stuff. I mean, and we see a president who then wants to punish our state because the governor speaks up and advocates, as I am a pastor and shepherds my people, she's trying to do hers. Thirdly, I think that, there are a lot of other folks who are not known and named. I've seen people around me that I've never seen do anything for anybody, who've been so moved by this crisis, who have stood up and done things. You see it all the time on TV, but there are thousands of more people without whom this would have been a lot worse. I think, we've got a lot to go. There's a lot of unknown information still. For example, with me, I still don't feel 100%. I had a same kind of conference with my cardiologist yesterday. My primary care physician is saying to me that it may be 6 to 8 weeks before I get back to normal.
Thanks for being with us.
All right, my friend.
Joining us now to talk about the economic dimension of coronavirus is Charlie Ballard. He is a professor of economics at Michigan State University.
Thanks, Stephen. Glad to be with you.
So I think the real question right now is how you divide the things that are happening that will have permanent effect from the things that will have, I guess, less than permanent effect. In other words, this idea that parts of the economy are just kind of frozen and they will thaw and go back to what they were, but others are being done great damage and we may not be able to just pick up where we were.
Yeah, I think the big challenge, or one of the biggest challenges, is to keep businesses alive, even if they're closed. Even if you're a restaurant and you have had to close, and so you don't have hardly any customers. Some restaurants don't have any customers, others are doing takeout, but it's not the same as it was. But if we can keep that business alive, then we're good. But what is a business? It's a series, a web of connections between this core and the customers, the suppliers, the insurance company and the bank that they work with, and their employees. If that business is forced to go under, if it goes bankrupt, if it folds up, then that web of connections is broken. And then it's much harder. If we can somehow keep these businesses afloat, well, we won't be okay. I mean, the damage is going to be profound, but I think it'll be a whole lot less for the long run if we can tide people and businesses over so that they can open up again in July or October or whenever it is, and keep people going, these stimulus checks, the unemployment checks, that's really important because a lot of the people, they're living from paycheck to paycheck. And now they got, I don't want those people to be evicted, have their water and electricity turned off.
Yeah. So when we talk about sustaining those businesses, sustaining people, we're talking about government at this point.
Yes.
Because that's the only institution that's still got the ability to leverage money. Give me an assessment of how the government has done so far with stimulus and keeping things intact.
I would give you 2 grades. The grade that I would give to the federal government before 2 weeks ago is an F. I mean, President Trump wasted 6 precious weeks saying that there's no problem, that it's a hoax created by the fake news media and the Democrats, and then he would go from that to saying, well, it's a small problem when we've got it totally under control. Those were 6 weeks during which we could have been making the preparations. And if we had mobilized the Defense Logistics Agency in the end of January and early February to put us on a wartime footing of mass producing masks and hospital gowns and gloves and doing a whole host of things and putting social isolation into effect long before it went into effect, we wouldn't be where we are today. So I give them an F up until a couple of weeks ago. But then I give maybe a B minus, maybe a B, because the maybe even a B plus. The Federal Reserve is pulling out all the stops to try to keep the financial system from completely freezing up. That's what happened in the fall of 08 and the winter of 09, and we know how bad that is. So the Federal Reserve trying all sorts of things, injecting hundreds of billions into the financial system, and then this stimulus package. Not perfect, but I compare that with what the Hoover administration did during the early 30s, which was the economy was imploding and they did nothing, essentially. So in this situation, we understand we have to do something. I don't think that any of these measures will solve the problem completely. The only thing that solves it is stopping the virus.
Going back to life as somewhat normal again, right?
Right, because as long as we know that people are putting their lives at risk to go back to ordinary work, we can't do that.
Yeah. I also wonder if you feel like there are already lessons for us when we do go back to life as normal about the economy and the way we were managing it before. And here I'm thinking sort of specifically about people who were left quite vulnerable by an economy that everybody agrees was doing quite well by many measures, but there were these gaps that were opening up and widening.
Right.
That's made all of this tougher because of this pandemic. Are there things we ought to rethink when we get back to normal?
Well, there are things that that I've been talking about for a long time. You and I have had discussions about the phenomenal increase in income inequality, how the growth that the economy until 3 weeks ago, our economy was much bigger than it was a few decades ago. Mm-hmm. And yet we can identify, especially people with only a high school diploma, their real income is less than it was back in the 70s in some cases. And so this phenomenal growth of the last 40 years has been not distributed well at all, in my view. And I think I'm hoping, I don't know what will happen, but I'm hoping that this will galvanize a discussion around helping those at the bottom, because public policy in the United States, for the most part, in the last 40 years, has been extraordinarily friendly to the top 1%, very friendly to the next 10%, not at all friendly to the bottom half. We have a minimum wage the federal minimum wage has stayed at $7.25 for, I believe it's 9 years. You can't set the minimum wage at $50 an hour. We understand that, but some modest increases in that. The earned income tax credit, we in Michigan scaled it back in 2011. I think that was a mistake. We're finally paying attention. Food banks are getting a lot of donations that they didn't get before. Well, that's great. We should continue to care about the disadvantaged long after the virus is under control.
Yeah. Last question. The repair of this, after it's over, do we get back to growth in the foreseeable future, or is this trigger a longer term recession that we just have to weather and dig out over a long period of time?
Well, a lot of people think when they hear recession, you're in recession until you get back to where you were at the start of the recession. The way economists think of it, you've gotten out of the recession once you start to grow. Yeah. So most recessions, it takes you a couple of years or maybe several years to get back to where you were at the beginning of it. Now, hard to predict this one because this is extraordinarily unusual. I mean, well, it's unique. We've never seen anything like this. Right. So if we can get the virus mostly under control in a few months, it's possible that this downturn, when all the dust has settled, that this will be a downturn that is really steep and severe, but then we might have a quick bounce back. Mm-hmm. But I don't think we can guarantee that. It so much depends upon whether we can get the virus completely under control. I'm sure you've seen some of these projections that say that maybe we get it mostly under control by sometime in May or June, but then as long as we haven't developed a vaccine, which may take many more months, it could bounce back at some point. And so until we've really got it fully under control, I think the economy is going to be vulnerable. The other thing, of course, getting back to what I said earlier, we'll be able to bounce back much more quickly if we can keep businesses alive, even if they're not doing much. If they're at least alive, then they can start back up. But if they really die, if they go all the way under, then it becomes more difficult. I do think that this is going to have huge long-run effects on how we behave. When you have a long supply chain and some of the medical devices are made in northern Italy or in central China, we have learned the hard way that is really problematic. And I think we're going to have, and I'm kind of an internationalist, so I don't want us to dramatically pull back from cooperation with other countries, but I think we're going to have to make some changes.
Finally, today we've got a little bit of music to help heal your mind and your soul during these tough times. Nova Zaii is an electronic music artist who invented the Nova Portals, a musical instrument that enables him to create sounds without touching the device. Here is Nova performing an original composition titled Zaii. That's our program for today. Thanks for joining us. You can see more of my interviews at AmericanBlackJournal.org. And always, you can connect with us on Facebook and on Twitter. Stay home and stay safe. We'll see you next time.
Masco Corporation is proud to manufacture innovative and environmentally friendly products for the home. Delta faucets, craft-made in Merillat cabinets, and Behr brand paints have all been designed with you in mind. Masco and its family of companies, serving Michigan communities since 1929.
Support also provided by the W.K. Kellogg Foundation, a partner with communities where children come first. The Cynthia and Etzel Ford Fund for Journalism at Detroit Public TV.
The DTE Foundation proudly supports 50 years of American Black Journal in covering African American history, culture, and politics. The DTE Foundation and American Black Journal, partners in presenting African American perspectives about our communities and in our world.
Also brought to you by Nissan Foundation and viewers like you. Thank you.